Hello everyone, this is Dr. 𝐦𝐨𝐫𝐿 from 𝐤𝐢𝐳𝐸 clinic at 𝐻𝐸𝐬𝐽 Hospital, Saket. The topic I'm going to talk about today is ectopic pregnancy. What is ectopic pregnancy? Ectopic means anything which is outside the normal, and pregnancy, you know what it is. So when the pregnancy is outside the uterus, which can be in the tubes or in the ovary, it's called as ectopic pregnancy. Why am I going to talk about this topic today? In my practice of last 10 years, I have seen many patients, they just go to the pharmacy and they say that we want to terminate the pregnancy. But they don't even know whether it's a normal pregnancy or it's an ectopic pregnancy. And at the end of the day, when they take the pills, they eventually end up rupturing their tubes and they land up in an emergency. My main concern is that whenever these patients come to us and they say that we want to terminate the pregnancy, I always ask them to get an ultrasound done, and they always ask me, ma'am, it's just early pregnancy, why do you want to get an ultrasound done? See, it is very important to determine the exact site of the pregnancy. Now, ectopic pregnancy can happen anywhere outside the uterus. So the commonest being the tube, which is like 97% of these kind of pregnancies happen in the tube. Then other areas could be ovary, or it could even happen in the cervix, and it could even happen in the abdomen. So that is why it is very important for you to know whether it is uterine or extrauterine. The normal process is when the fertilization happens, that is when the two gametes meet, the ova and the sperm, the fertilization takes place in the tube and then it enters the uterus and where the implantation takes place. But sometimes this normal process does not happen. There are factors which hamper the normal process, and it does not let this happen, and it causes ectopic pregnancy. What are the factors which cause these? Now there are two things. Number one, there are factors which will not let the fertilized ovum enter into the uterine cavity. And the other thing is that there are certain factors which will let them stay inside the tube. It will favor the fertilized ova to stay inside the tube, and thus this leads to ectopic pregnancy. I will be now talking about the factors one by one, explaining them in detail to you. The first and the foremost and the most important cause of ectopic pregnancy is PID. PID means pelvic inflammatory disease. Now, any kind of infection in the tube will not let the fertilized ovum get transferred into the uterus and lead to a normal pregnancy. How does that happen is that there are, the hair-like projections in the tube which are known as cilia. They basically propel this fertilized ovum into the uterine cavity. But in cases of any infection, this just does not happen and the fertilized ovum stays inside the tube. The other thing is, because of these infections, there are these adhesion pockets which are formed inside the tube, which does not let that happen. Now see, tube is a very narrow structure. We basically cannot tell you whether the cilia is functioning or it's not functioning, but it's your history which will tell us and guide us whether you have this kind of infection or not. Chlamydia is the most common infection which let this happen and which is the most common cause of tubal pregnancy. Thus, when a patient comes to us and he says or she says that she's got ectopic pregnancy in the past, or sometimes that she's not able to conceive or she's had recurrent abortions, we ask them to get them tested for chlamydia infections. The other most common cause these days is when these patients use emergency contraception. They are not aware of it, that ectopic pregnancy is a side effect of these emergency contraception. I have seen patients, they've started using emergency contraception as regular contraception. So now this hormone which is there in this emergency contraception is progesterone, and it decreases the motility of the tube. So once the motility of the tube is decreased, it will not let the fertilized ovum enter the uterine cavity. So it does not guarantee that you cannot be pregnant, and if you are pregnant, you can have an ectopic pregnancy. So be very, very cautious while taking this pill. The other factors which are there are if you've had any kind of tubal surgery in the past. Like, people do get sterilization surgeries, and if sterilization surgery have not been done properly, they can also lead to ectopic pregnancy. Earlier it was said that, while using IUCD, intrauterine devices, intrauterine contraceptive devices can also lead to ectopic pregnancy, but the ones which are available now, they don't really cause any problem and they do not lead to ectopic pregnancy. Now, if we talk about factors which favor the fertilized ovum to stay in the tube, the most common cause is tubal endometriosis, and endometriosis is very common these days, which can lead to tubal adhesions and thus ectopic pregnancy. Now let's talk about types of ectopic pregnancy. The most risky one is acute ruptured. Then you have unruptured, and then you have another one which is known as chronic. So you have acute, ruptured and chronic ectopic pregnancy. I will be talking to you mainly about the acute ruptured because that is the most serious one. So acute ruptured pregnancy, acute ruptured ectopic pregnancy may present as a triad. It presents like a triad in which we have period of amenorrhea, unilateral uneasiness, that is pain on one side, and some kind of bleeding. So this forms a triad. But it is not necessary that all the patients will present like that. Some patients will just have a normal period and they will then come and say that we've got some kind of pain. The pain is acute. But when you ask them, did you miss your period? They will say, no, we've had a regular period. But when you dig in through and ask them, was this period different from the period which you generally have? And then they will say, yes, it was a little less than what we generally get, or it was a little more, or it was a little more painful than what we get. So it is very important for us doctors to ask you, we have to dig into your history and ask you what were the exact problems. Why do you get such severe pain? This is because of the blood, the tube gets distended. There is colic inside the tubal muscles. Now, if the bleeding has started happening outside, it will irritate your diaphragm and it will cause shoulder pain. That is a very common sign which will tell us now there is a lot of bleeding which has happened inside and this is the time to act in emergency. Act now. Now, let us just talk about how this pain presents. This pain will be acute, it will be severe, it will be on one of the sides depending on where the ectopic pregnancy is. But if the bleeding has happened inside and the bleeding has been severe, this can cause a lot of diaphragmatic irritation and the entire abdomen can be tense and tender. That means you will not even let anybody touch it and it will be really tight. Now, if you've had an acute ruptured ectopic pregnancy, what next? Once you come to our emergency, we will examine you. We will send your blood investigations immediately for blood grouping, your CBC and viral markers, because this is time when we have to immediately take you to the operation theatre. Once everything is confirmed, the operation theatre is ready, we roll you in and then we decide on the table whether we need to remove your tube or we can just remove the pregnancy. So there are various surgical options depending on what kind of ectopic pregnancy it is. If the ectopic pregnancy has damaged your tube, we have to take out the tube. Now, this is known as salpingectomy. It is very important to decide that whether the tube has to be taken out or not. The tube has to be taken out in cases when it is damaged because we want to prevent any kind of repeated episode. We don't want you to have a repeated ectopic pregnancy as it can endanger your life. This time you are safe, but next time we don't know what's going to happen. Then if the tube is not damaged, if we see that the tube is fine, it is red in color, what we do is a salpingostomy or salpingotomy. That is where we just make a hole, take out the pregnancy, flush out your tubes and that's it. But please let this decision be on your doctor because the doctor is the best person to decide there and there what has to be done for your own safety. Now, this kind of pain can be differentiated from other pains also, in the sense that patient will come to you and they will say that we've missed our period or we've had a little bit of spotting, we are having severe pain. So that indicates that you've ectopic pregnancy. But there are times when it could be other things also. We might get confused that there are other things, that is differential diagnosis of ectopic pregnancy. Differential diagnosis of acute ruptured ectopic pregnancy are ovarian torsion, ruptured corpus luteal cyst, acute appendicitis, urinary tract infection. I hope you all liked this video. If you find it informative, kindly like it, subscribe it, and share it. Thank you.